Good afternoon, everyone. My name is Charlie Evers, and I'm the president of the third year class, and I'm an MS3 on the Tuscaloosa Medical Campus. I'm here today to introduce Dr. Selwyn Vickers for his 8th annual State of the School address. Dr. Vickers is the James C. Lee Jr. Endowed Chair, the Dean of the UAB Heersink School of Medicine, and the CEO of the UAB Health System, and the CEO of the UAB Ascension St. Vincent's Alliance. The first time I met Dr. Vickers was when I had my photo taken with him at my white coat ceremony. It was a meaningful 9 seconds for us both. In all seriousness, students really appreciate sharing special moments like white coat with our dean and leaders. What we value more, though, is the voice the students have under his leadership. Dr. Vickers and his team constantly implement changes based on student feedback and genuinely care about our well-being and work to no end to improve the education we receive. Dr. Vickers and his team have done a phenomenal job providing students with the resources and supports needed to succeed throughout the pandemic. Under his leadership, students have continued to thrive despite the challenges we have faced. Thank you, Dr. Vickers. And without further ado, please welcome Dr. Vickers.
Thank you, Charlie. So I really appreciate your introduction and comments. Our goal certainly during this experience was clearly to make as much as we can this the most reasonable and highest level of opportunity to continue your training, which was fundamental to what we wanted to do. Okay. So we'll get started. Thank you again. And I appreciate all of those who've joined. And Charlie, our goal was to really make, and still is to make, you and the rest of the students feel like you're in the best medical school in America, both by support, the delivery and the education we provide, and for the opportunities you will have when you finish. Thank you for that kind introduction. And I'm very appreciative of all the things that you said, but particularly our team that has worked so hard to support our medical students, our staff, our physicians, and our community. As Charlie said, this is our 8th annual, if you would, State of the School address. And we're still in our pandemic. And because of that, I really want to take time to thank all of those who've served so hard. Everyone who works at UAB has taken some step of leadership to serve our community, whether it's dealing with food, whether it's taking out any other sort of trash or anything out of a room. They're serving the state and our citizens, as well as our staff, nurses, and physicians, to make a difference in the lives of our patients. We couldn't be here today to speak about this, nor could we celebrate some of the accomplishments without the hard work of our community in serving Birmingham, Jefferson County, the state of Alabama, and America. So thank you all again for the tremendous service that you give now and are giving and will give in the future. Clearly, much of what we've been able to accomplish is not only due to our staff, but to a number of leaders. In particular, I want to thank Dr. Watts for his continual visionary leadership and commitment to excellence, even in the face of strong winds blowing against us through this pandemic. I think he and Dr. Benoit, Brian Burnett, and others in his cabinet who've been fundamental for us being able to be successful. A part of this process of leading, often that's not mentioned, is our communications teams. They have been a phenomenal resource for us throughout this entire period. Our communication teams in the health system, in the School of Medicine, and at the university level have been instrumental in conveying the messages that we need to share with our community for us to go forward. These individuals here, our chairs, have really buckled up and have delivered and served in tremendous ways of leading the faculty, still conducting research, invested in taking care of our patients who are often extremely ill, as well as continuing to train the next generation of physicians to care for our patients, as well as physician scientists. Thank you all again for leading by example. I clearly look forward to this next step of working with Reed Jones, the CEO of UAB Medicine, and Don Bugarella, who is the president of UAB Health System, and Jason Alexander, the CEO of St. Vincent's, as we move the alliance further. I will speak about that a little bit later, but thank all of you for your leadership and what you have done and what you will do in the future. That leadership has led to some unique recognition. Earlier this year in the New York Times, an ad read highlighting UAB, University of Alabama at Birmingham, and UAB Medicine was America's best large employer. That's a phenomenal and outstanding recognition. It only becomes to light how important it is when you realize who else was on the list. That includes Yale, the Mayo Clinic, Costco, Microsoft, Netflix. Besting them all was UAB. We have every reason to be proud of the place we work, those whom we serve, and the significance we bring to our country and to our city and state by that service and that pursuit of excellence. Along with that, we were recognized as the best employer in America for a university for diversity. And that too is core to our mission. Pursuing excellence, being a diverse community, understanding and believing that that is about excellence is what we are and what we've done. And we appreciate the recognition on a national level for those accomplishments. As you know now, we are called the UAB Marnix E. Heersink School of Medicine. For nearly 7 years, Ray, myself, our dean's leadership team have pondered the opportunity of what it would mean to have a naming gift for our school for multiple reasons, not only for the fact that it puts us in a very distinct and distinguished category. Very few state schools can have this. It reminds us of the Feinberg School at Northwestern, the Perlman School at Penn, but it also is one that it would recognize the hard work and the labor of our faculty and staff and scientists who've driven the reputation of our school to a level that hopefully will continually exceed our expectations. Marnix and Mary are extremely generous. And as you see in this gift, it's a generous beyond anyone else in the state of Alabama. It's the largest gift, and in fact, one of the largest gifts in the country to any academic institution. The reality is Marnix and Mary live in Dothan, but they are global citizens, both in their focus and their pursuit, as Marnix says, the 3 E's of excellence, encompassing, and really pushing ourselves toward to exceed all the things that we've thought about. But his ideas of pursuing the level of excellence that we want were parallel with the vision that he had for his own life, his practice, and his family. 3 of Marnix's children had the privilege, and we had the privilege, I should say, of training 3 of his children to finish our medical school. And he had others who've gone to school at UAB as well. But as I got to know he and Mary, I was most encouraged, not so much even about the gift, but the values that they share, the vision that they have for their lives and they have for us in the school that really meld and made me proud, in fact, to both hear him desire to actually name our school, but also proud that his name would be on our school. So this is a unique gift that means a tremendous amount and will continually propel us to grow toward a trajectory that hopefully will move us from excellence excellence to being exceptional. The gift provides endowments to really retain and recruit new faculty, endowed professorships, endowed chairs. It allows us to invest in programs and equipment that our faculty need to be competitive for their research. And it expands our education programs. Even though it's 100 million, it makes a big difference. It doesn't cover all the needs, and so we continually need to grow to support the programs. But the gift itself makes a huge difference in what we can be and what we strive to be as a medical school. Specific to their interest and aligned with ours, Marnix and Mary have a passion for two areas. The first area is really the success and growth of UAB School of Medicine. Under those are these two spaces of biomedical innovation and global health. Mary has had a long time passion for global health initiatives, working with McMaster's and Maastricht University in the Netherlands, as well as having a vision to impact public health care throughout sub-Saharan Africa. In addition, Marnix has had a long time passion for innovation and entrepreneurship. In some ways, is a serial entrepreneur, and his ability to be able to make this gift really ties to his success, not only as an outstanding ophthalmologist in Dothan, but also to an outstanding and successful businessman in Alabama and the Southeast. We're so appreciative of the gift and being able to expand our global health footprint and to be able to add an Institute for Biomedical Innovation. The gift, as you saw, was $95 million. And that was a small inside compliment that I'll make to Marnix. But the final part of that gift was from Triton Health Systems for $5 million to make this $100 million commitment that validates our progress and our growth. I would say over the last 7 years, one of the strongest wins in the sales of the medical school has been Triton and Viva Health. We're so appreciative of this gift, but the annual contributions they make to our School of Medicine are essential and in many ways have transformed where we are today, like the single gift from the Heersinks. Well, we continually pursue research as a means of growing our both opportunities for discoveries to impact the patients who we serve, as well as to continually attract talent in a state where teams mean a great deal. Most of us understanding that the real value of teams is their ability to execute together, but also the members of the team that is made up of the talent that often comes from around the country. That's no different than in an academic medical center. Our success, our ability to compete is really based on the talent that we can keep here and the talent that we can bring in. And as you can see, we've continually grown from our ranks from 2013. We're either 22 or 22nd this year, depending on the final numbers from the NIH, which will be close to our highest ranking. We continually want to move to be well inside of that top 20. But I'm appreciative of all of the principal investigators that you see, as well as I'm really thankful for the scientists that have driven this growth. Particularly this year, there are 2 grants that were nationally outlined for most medical schools to want to compete for. One of those was the first award, and this is a transformative award from the NIH to support medical institutions to gain a new foothold and create new paradigms for recruiting underrepresented minority faculty. We were one of the first 5 in the country awarded this grant, where several others across the country are still applying and clearly wanted to be included in that first list. We were fortunate to be one of the first 5 awarded and the only one that included a partnership, ours with Tuskegee. It highlights both this issue that we are a leader in diversity, we are a leader in accumulation of talent and a place where that talent can grow and impact their world. The other grant that we acquired in this scenario, and that grant was nearly $15 million that I just described. The other grant that we worked on for several years that came to fruition was our Center for Chronic Disease. We made the plea to Director Collins when he was here that UAB could be really of service not only to Alabama, but the nation, because where we sit in the burden of chronic disease is greater than any place else in America. Who we are is uniquely strong and capable as a public academic medical center to make a difference in that disease. This year, we competed with several other universities and were successful in obtaining our Chronic Disease Center. Both of these grants are transformative. The Chronic Disease Center is one that now is over $20 million, and it involves the concepts of affecting care, not only in Alabama, Mississippi, and Louisiana. So the research world we live in continues to grow. We're extremely proud of our faculty and what they have brought to the table to make us competitive. Training is at the core of who we are. part of our responsibility, but clearly part of our passion, is providing a venue where our medical students can feel like they're getting the best training in the country, as I mentioned. Beyond that, our residents, we know and believe, also have an outstanding experience, often coming from around the country to come to UAB to pursue the further development of their careers as physicians. And as you can see, we also train a number of scientists and students in our programs and postdoctoral fellows, which really propel the science and the growth of our research world. Every 8 years, we come to a point where our accrediting society asks the question, who are we as a medical school and what have we done? The SME accreditation, as I've said, when I first arrived in 2013, is like the Joint Commission for a hospital. It's like the good housekeeping seal of approval for an appliance. It is the same for us, and we want to do well, and we've been preparing for the last 2.5 to 3 years for this very moment. I want to thank the leaders who've worked hard under Dr. Hosley, supported by Liz Rom and Tony Leaf. I want to thank our faculty and our chairs who've participated in a significant way. We almost finished and are beginning to turn in our final documents, preparing for this April 11th and 13th. I'm confident we will do well, and I'm confident they'll find that who we are as a medical school is one that's outstanding. And what we have done has been significant and very impactful for our students and our citizens. As a school, as you know, we have a distributed model. We have campuses both in Birmingham, Tuscaloosa, and Huntsville. In addition, our most recent campus over the last 3 to 4 years is in Montgomery. And we have a new dean, Dr. Louis Lambiazzi, who joined us from the University of Tennessee. We're excited to have him here. These campuses are fundamental to our success in our model, and they're fundamental to excelling and providing the environment that our medical students need to have a successful experience in preparing them to graduate and enter their residencies. Welcome, Lou. Thank you for your hard work, Roger and Richard, for your work in Tuscaloosa, Roger in Huntsville. As it relates to taking care of our patients, our staff, our nurses, and our physicians have gone above and beyond the call of duty. We've shared a burden of caring for our state greater than any hospital in our state. We've stepped up to do testing for our region, for our state, at multiple levels. We stepped up to actually give vaccines. We've stepped up to really save lives on a daily basis. Today, we're near 300 patients in our hospital who have the diagnosis of COVID. Although some of them are in for other areas, the numbers are still staggering and stressful for our caregivers. You can see that we've had almost 230,000 COVID appointments, 1.8 million clinical encounters, nearly 130,000 emergency visits, and our hospital steadily stays greater than 90% occupied. Optimally, it's 80 to 85%. We never go below 90 because of the desire to be at UAB, but most of all because of the outstanding care people receive. You've often heard me say that I want our institution to be locally relevant and vital to our community, but globally impactful. This next slide shows and typifies that spirit at UAB. Dr. Jamie Locke and Dr. Paige Perrette, working with the partnership with United Therapeutics and the Jim Parsons family, were able to do multiple world's firsts, but specifically to be the first to put a 10-gene genetically altered pig from a clinical grade model. And that is the organs transferred and removed in a pathogen-free facility, transported to UAB, and then placed in a patient as they were going to be placed in a patient who was going to live on in order to secure their function and determine, which is a real question, whether there would be an hyperacute rejection. The process, the planning, as well as the results were near flawless. In short order, after reestablishing blood supply to the pig kidney, the kidney pinked up and in short order did its job and made urine. That alone, in some ways, was earth-shattering. An editorial in the American Journal of Transplantation by one of our colleagues, Dr. Alan Kirk, who's the chair of surgery at Duke, praises the team at UAB for multiple things, not only answering the question that has really weighed heavily and prevented xenotransplantation from going forward, but taking the standard and keeping the standard of making sure our scientific colleagues had a chance to review our work before we announced it publicly. He commented that peer review is often forgotten, but it's absolutely necessary for science to advance. And what's amazing about UAB is that we kept that standard, not only for ourselves, for our nation, but for our patients. So kudos to all of those who participated in this. We thank the Parsons family, as Dr. Locke has referred to as the Parsons model. We're thankful for their generosity, their husband's vision to make a difference, either by donating his organs or participating in a study like this. This again, hopefully makes you proud of UAB, whether you live in New York or Florida, but most importantly, if you live in Alabama. Many of you ask the question about the alliance, the UAB St. Vincent's Ascension Alliance. In short, when Dr. Watts and I and Dr. Fernandi and I thought about this, the fundamental thing and reason that we pursued this, that this alliance is essential for us moving from excellence to exceptional. Again, I'll repeat that. It's essential for us moving to who we are to be something exceptional. That means both opportunities for greater clinical care, expansion of our abilities to take care of complex patients through complex procedures. It also means a greater ability to support our broad academic singular mission of transforming the lives of our citizens, which are sometimes some of the sickest in our country. So you will hear more about the Alliance, but I want to reassure you how vital it is to the success of the vision that we put forward and to our future. And we will be working to make this dream realized even more over the next several months. We've given a number of vaccine doses, and God knows we'd love to give more. The pandemic now still remains, particularly as it relates to hospital admissions, a pandemic of the unvaccinated. I too support the process of individuals having choice, but I understand that choices are not without consequence. And we realize that if we step back and look a year in past, we want to ask ourselves, why were we begging for a vaccine? Why were we crying for some help? And UAB has been a participant in that, addressing that cry from the very beginning. Remdesivir, which has now gotten a new life, because studies showing, though, there aren't any monoclonal antibodies that really, from the American companies, Lilly and Regeneron, that have any effect on the Omicron variant. It's only the GSK antibody that does this in short supply. That remdesivir, now given in the outpatient setting, has an 87% improvement of keeping people out of the hospital with Omicron. Remdesivir, in part, was developed at UAB under our U19 leadership. Rich Whitley, who's led that grant, North Carolina and Vanderbilt. Part of the preclinical studies were done here with Gilead. And so again, we've been at the table offering opportunities. We clearly, even with that, wanted to see vaccines, because if you look at this chart alone and see what happened to African Americans in the midst of the height of the pandemic without vaccines, the death rate was sometimes 2- and 3-fold greater than their percentage in the population. This alone is disturbing, was depressing and disheartening. And from that was our desire for a vaccine. Now that we have it, I challenge us all, get vaccinated. In the normal world we live in, I've said to others around me, we in medicine work on the principles of building trust and purveying the truth. And there are many times we have to work with patients to understand, although they feel well and don't see it, that there's something serious going on in their lives. This same principle surrounds our interest and desire for people to get vaccinated. As it relates to this year, we've not only dealt with the challenge of the COVID-19 experience, the impact of the COVID on health disparities, the stress to our health system, the lives that are lost, and the businesses that have suffered. We've also dealt with really a heightened understanding of racial injustice, particularly as it related to George Floyd's life, Ahmaud Arbery, and others. But in spite of that, UAB again has been a part of helping lead the country in ways that can help us grow closer and reduce our differences. This slide shows a documentary that UAB Medicine was essentially a core part of sponsoring with Dr. Henry Panion, the Community Foundation, and Mr. Jeffrey Baer, who's a member of our HSF board. This documentary captivated the world with over 110 million people seeing it. It exhibited the Violins of Hope, which are a set of violins that were recovered from Auschwitz, played by Jewish musicians before their loved ones were sent to death. Those violins were recaptured and restored by the Weissman family in Tel Aviv. They were brought to Birmingham, and Dr. Henry Panion, who really is at the center of this, composed a piece of Jewish High Holy Day prayers and Christian anthems. And that piece was played, as Amnon Weissman said, in the most significant place in the world for these violins to be played, the 16th Street Baptist Church. That piece was played by an African-American concert violinist, Caitlin Edwards, who was born in Birmingham, Alabama, but who lives in Chicago. The world saw that stage. It saw that Birmingham is a place that not only is informed by its history, but it really is going to be defined by its vision for a future to lead the world as a place where dialogue, interaction around human and civil rights can occur. And Dreams of Hope will hopefully be an annual event that will highlight Birmingham's role to lead the world in greater understanding of our similarities, greater support for human and civil rights across the globe. This was obviously a dream that we had, but didn't have any idea of how many awards it would win. It won 13 Telly Awards. And then most recently, it's won 2 Emmy Awards. That's more Telly Awards than any documentary has won in history. This is, again, an example of how UAB and Birmingham are seeking to change the world for better and leading the way in doing so. Now, we've talked about our growth, and it's been pronounced. But as you can imagine, we're stretched and pushed on many sides because of that growth. And so now, as we've tried to do, but even in a ramped up fashion, we want to focus on our infrastructure. The first picture I'll show you is the new Heersink Biomedical Innovation Conference Center. It will be 2 floors of really state-of-the-art space for a large conference room, breakout rooms, gathering areas that is desperately needed on our community. We think it will be really one of the best in the country. It will serve our faculty, our staff, and our community in a significant way, expanding what we have now to provide this opportunity to continually gather, teach, train, and learn. In addition, we want to thank the Steislinger family, the state of Alabama, the city of Birmingham, and the county of Jefferson County for supporting us in putting together the dollars as it relates to the Altick Steislinger Genomic Medicine and Data Science Building. This highlights our renewed focus on dry lab research. We've recruited a number of great basic scientists who've made their careers in the wet lab space, but we realize there is a unique opportunity for data science, outcomes research, health disparities research, health policy research, health services research, all fitting in that dry lab space to really propel UAB's growth. This will be a phenomenal facility for allowing that to take place, not only to retain our best and brightest, but to recruit and track them to UAB in Birmingham. We want to continually expand and provide the opportunities and space for our medical students to really have a sense they're training in state-of-the-art facilities. Renovations are going on now for the 6th floor, for that to be moved to an administrative area. And then renovations will occur on the 2nd floor to make this a flipped classroom open area, as well as you can see a new, as well as you might not see in this setting, a new atrium that will open up the school as it provides a new entrance for Volcker. In addition, although we're adding dry lab space, we are also still in desperate need of new wet lab space. McCallum is our largest basic science research building, over 100,000 square feet with 80,000 new assignable square feet. It is being transformed from top to bottom, both outside and inside. It's beautiful space for our scientists. As we continually expand it, it's in great need and demand for both our faculty here and faculty who we would seek to recruit. Many have asked about this new position and have wondered, one, are we reinventing the wheel? Are we doing something that's a bit out of bounds? Well, in reality, as hopefully you're seeing this slide, we're not the first to do this. Many institutions have believed that having a single strategic academic leader with key powerful individuals to serve and administrate and lead core parts of the mission is a fundamental strategy toward moving from excellence to exceptional. And that certainly is our view. I think the other thing I'll mention to you about unified leadership, I certainly have difficulty putting confidence in a single individual to have all the skills and attributes to create or to drive everything toward this process of excellence to exceptional. What I do have confidence in is the power of teams. Individuals coming together, working toward excellence, expounding and excelling in their skills to lead in their area. What we now have is not an amalgamation of School of Medicine, health system, or HSF. They all have their distinct roles to push us toward being exceptional. They have to excel in their lane for us to get there. There clearly will be more cross-pollination, but the mission is one, providing outstanding, innovative care for our patients, whether it's through new research discovery, training the next set of physician leaders, or caring for that patient today. All of those will be driven by the power of teams. I'm extremely fortunate to have an outstanding Dean's leadership team. You know them all. Dr. Agarwal, who serves as Executive Vice Dean, Dr. Benvenisti, who's our Vice Dean for Research, as well as all of our other senior deans who've driven success, whether it's in diversity with Dr. Fuad, Dr. Rogers around wellness, Dr. Hosley as it relates to education, Dr. Kimberly for our CCTS. And then particularly, none of this is real possible without finances. Lakeisha Mack has done a phenomenal job in keeping us on track to be viable and focused. And there are many others in the Dean's office who I've personally told them how valuable they are and what they've meant. As I move to the health system, a similar group of talented individuals will allow us success. Reed Jones is the CEO of UAB Medicine. Jason Alexander, the CEO of St. Vincent's. Don Bugarella, the president of our health system. Tony Jones, the president of our practice plan. Those individuals are critical for our success. Functioning as a team, that's where your confidence should be. That's where we provide the opportunity to move from excellence to being exceptional. It's that team and it's those teams that are going to give us the opportunity to be an outstanding institution and to reach the vision and goals that we've put forward. These circles show the three areas that I mentioned. And again, as they come together, they still have their distinctiveness going toward a single mission, making a difference for our patients. So we like to believe and really fundamentally are committed to be an exceptional academic medical center. It's a journey, but we will get there. And all the things that we've shared today, I think are fundamental to reaching that dream. Thank you all for an opportunity to present the state of the school, and I look forward to questions.
Hi, good afternoon. Thank you, Dr. Vickers. My name is Mary Ashley. I'm going to be helping Dr. Vickers with the question and answer session. Dr. Vickers, you are welcome to stop sharing your screen now. And we will get started with some questions that were submitted ahead of time in the registration. So Dr. Vickers, the first question is about remote work long-term in the Heersink School of Medicine. Could you provide a detailed update on the remote work policy for Heersink employees?
The answer is no. I can't provide a detailed update. What I will provide is that there clearly will be flexibility as we go forward. I don't see that we will have everybody remote. I see at some point, if not all of us, a significant part of us coming back in. But with that statement, I also see having flexibility. Now, all of this certainly works under the rubric of the university as well, where the School of Medicine sits. But in practice, I think we understand the balance of what we need to be competitive to keep our talent, particularly when that talent can function and improve their functioning in a remote setting. There's clearly opportunity for hybrid work, and that is being in place, being in person, to take advantage of the value that it means to connect with someone, but also have someone the privilege to work remotely. But I also say that we all understand the value that we miss of being able to connect in person in order to achieve our goals. So I don't know that we ever want to lose that. But yet, one of the lessons we're going to learn from the pandemic is that successful conduction of a person's job can occur for certain entities in a remote setting.
Thank you, Dr. Vickers. The next question is on research and wet labs. The question is, even with ongoing renovations, we still have no real space for growing our labs. Can you provide an update on expanding and improving wet labs?
Yeah, so we're trying to see if we can build and change and reform and restore as quick as possible. I think when we started this, we realized that we needed to actually make sure that we were as efficient as we could in the use of our space. And we still have to always continually do that. When we look at our peers, that's fundamental to their success, that they are always looking at the efficient use of the space. Now, I won't deny, as I talked to Dr. Benvenisti, she feels like she has to create space out of thin air because there's not a lot of new space available. So that in part is how Dr. Watts and I are looking very hard of how we can build an additional new wet lab basic science building. We've committed and are now pushing through the renovation of all three phases of McCallum. Now, I think you must know that we set budgets for these buildings, we get money for them, but in the current time, with supply chain cost, labor limitation, many of the costs of our buildings have exploded, sometimes up to 20, 25, 30% more than what we've calculated. So that puts a new stress too on how we get this done and how we stage it. So we are extremely aware that we need more wet lab space. We have to remain collaborative as a community for those who have space to share it as new recruits come in, and for those who here are using their space to maximize its use and efficiency as we go forward.
Thank you, Dr. Vickers. The next question is on your personal career. And the question says, I know you didn't get to where you are without overcoming major challenges. How did you gain the strength to persevere through any difficult seasons of your life?
Yeah, I think the biggest challenge that I would say, there are a couple of things, but the biggest challenge I had to overcome first was the perception of what I potentially could do as an African-American male. I had to move beyond what I perceived as limitations from my society, upbringing, and what culture told me. I had to believe that I could be as good as anybody, but that wasn't always the case, and that wasn't always reinforced. And so there were multiple stages in my life where I had to ask the question, did I belong? Was I capable? And was I really willing to work to find out the answer to those questions? I think because I'm also a person of faith, that's also been a big part of helping me in those times of peril and challenge to my dreams. And it still does. But in that process, I think those two fundamental things is to realize that there are really a number of things that I could do, and that really in some ways there's no limit, but also understanding that it took a lot of hard work, unique opportunity, as well as in my part, having faith that that would occur.
Thank you so much for that. We have a few more questions that were sent in registration. I do want to encourage anyone who's listening to please drop any live questions you have in the Q&A box, and we'll get to those if we have time. The next question, Dr. Vickers, is about the Alliance. And it says, what can we expect in a return on the investment of our time in the Alliance, and when can we expect that return?
Yeah. So I think that in some ways, the first part of us with the Alliance is to announce some of the things that actually have occurred and have been beneficial. We've had a number of services working together to decrease the capacity here at UAB. We're clearly dealing with distinct cultures. So the ability for us to move at 100 miles an hour and not create havoc is not there yet. The second piece is that as it relates to our return, particularly on the investment, as I mentioned to you, the goal again is to continually have a platform where we can reduce in some ways the capacity of the patient care opportunities at UAB, expand them throughout the Alliance to create greater opportunity for patient care and revenue delivery. And I realize for a lot of people walking in the hallways, they really worry and question, what does this mean? And why are we doing it? Because it doesn't seem to affect who I am. I again step back to ask myself the same question. Who we want to be as it relates to excellent, to exceptional, cannot occur on this clinical footprint alone. We cannot be who we want to be just on this hospital. We've maxed it out. We're at 95%. And so if we want to be that dream of where we want to be exceptional and truly elite, it cannot occur just on this UAB Birmingham Medical Campus. It has to incorporate some level of growth and engagement of opportunity in the Alliance to expand our footprint to do that. So none of us want to stay the same and stay where we are. We want to be better, bigger, and more impactful. The Alliance is a fundamental part of us trying to achieve that. So I couldn't answer specifically when you personally will feel it. Hopefully more globally as an institution, we'll see the positive impact over the next several months.
Wonderful. In the same category as patient care, we do have a question about nurses. It is a two-part question. One is, will UAB Hospital be increasing wages for nurses and other support staff? And the second question is, when will UAB Hospital recruit enough full-time permanent nurses?
Yeah, so we have several hundred open positions that we're advertising for people to work at UAB in our nursing community. So we're constantly doing all we can to retain and recruit. Secondly, yes, we are and have made it clear that we are going to raise wages, not only for nurses, but the clinical staff who are part of that whole picture and the working staff that relate to the full care of our patients. That has been a significant amount of resources put in our budget to the tune of over $60 million new dollars this year. That adds on to another 20 million that we had in. We fundamentally want them to feel valued, not only just by their salaries, but also by the environment they work in and the sense of the support they get from us. So there are multiple areas that Terry Pohl, Anthony Patterson, and Reed Jones and others are working to make sure that when we change that compensation picture and value for our nurses, that we change and improve the understanding of their value here at UAB. And we offer incentives and open doors to recruit nurses who would come and work as soon as they can and as many as they can, because we have plenty of space.
Great. The next question is about your strategic vision and the hospital's strategic vision. It says, is there a strategic vision to incorporate more community hospitals in Alabama into the UAB health system? And then there's kind of a follow-up part of that question, which says, is the goal to bring in more physician CEOs of hospitals like in other systems such as Johns Hopkins, Mayo Clinic, and the Cleveland Clinic?
Yeah, I think the first question is, strategically, we want to impact the healthcare of our citizens throughout our state. We realize that that can occur through multiple ways. One of them are these rural hospital associations, alliances, and incorporations into our health system. And I think thus far, we've added tremendous value to the rural hospitals we brought in. We've added some expertise and support, not only for their operations, but we've given them the link in the environment to recruit and retain more talent and open more services. We want to do that even more. So if the question is, do we want to involve more rural hospitals? Strategically, we do. We want to do it wisely, and we want to do it in those where we can make a difference and benefit them and ourselves by impacting their operations, their staffing, as well as the care of the citizens where they're located. Now, as it relates to the model of Johns Hopkins, if the question is, would I envision UAB to be similar to that model? I think so. And hopefully beyond me, it will be the model that our institution adopts. So absolutely, I hope it does.
Wonderful. We have two more questions that were sent in from registration that we'll get to now, and then we'll start taking some live questions. The first question is from a new faculty member, and they ask, what is the one thing you want all new faculty, and let's just say for the sake of the question, faculty and staff, to know about UAB and your vision for the institution?
You know, the one thing that I would want them to know, I've sort of iterated in the slide, that number one, there's a space for everybody to be a part of this singular mission of transforming the lives and care of our patients. Whether they're a research faculty member intensively looking at basic science areas, or they're a clinical translational research faculty member, whether they're a clinical care provider, nurse, environmental services, dietary services, or whether they're actually just an educator, and not just is the word, but whether they focus just on education or focus on education along with these other things. There is a space for you to feel valued and to be a part of a mission that really pushes us to be the premier academic medical center in the country. Largely because where we are, we're the youngest in our class. Number two, we're one of the largest in our class, and now we're fighting to be the best, and that's being exceptional. So I want them to understand that that's who we are. The final piece I would say is that how we've gotten there is not by having silos or individualism. We have been a place of collaboration and community in order to achieve our goals. And I clearly want the new faculty members to experience that this is an environment where they need support, they want to partner. That's a part of our DNA.
Wonderful. So the next question is a similar question. What do you want faculty and staff to know about your vision for the greater Birmingham community, the entire state of Alabama, especially around health disparities?
Well, I go back to the sports analogy. You know, our teams in this state have great coaches, but I would tell you that those coaches would tell you that their success certainly has something to do with competent and capable leadership, but it has most to do with the talent that they put on the field. So what I would love Birmingham and UAB and Alabama to be is to be a nidus for talent to desire to be here as their first choice. I want Birmingham to be seen as a place where innovation occurs. Again, where our history has informed us, but our future is defining a new vision for the world as it relates to race relations, justice, civil dialogue around human and civil rights. I want Birmingham to be a beacon for that. I think one of the most powerful things that Birmingham has and can own, principles from Martin Luther King's letter from a Birmingham jail, resonate with our time now more than ever. They challenge all of us to understand that our decisions and what we do affect all of us. that we are inextricably linked. What affects one directly affects another indirectly. And the second piece is that he emphasized that it's not those who in the extreme who oppose us that will challenge us as we look back upon our lives and ask questions why. He made it very clear, as well as others, what will really disturb us the most is not the voices of our enemies, but it's the silence of our friends. It's King's plea for good people to stand up and do what's right and not really capitulate to the culture. So I'd love for Birmingham and UAB to be a beacon of light for that message, those principles that are timeless and that we own in Birmingham.
Wonderful. Thank you so much for that. And thanks to everyone who submitted questions ahead of time. We do have a few minutes to take a few live questions. The first one is about the video that you recently did about critical needs for blood in Alabama. The question says, what is causing this blood shortage and how can the UAB community give blood?
You know, I'll be honest, I think it's multifactorial. It's obviously access to our hospitals. It's people who are dealing with illnesses in large numbers, people concerned about getting infections, and people just occupied with just trying to live a safe life. Sometimes stresses like this remove you from the normal behavior that has often defined who we are as a community. And clearly, we've been one that we've generously donated blood. But in these times, I think there's been disruptive. And so I think we have to make that emphasis for people to understand the tremendous need we have.
Great. I'm looking through some of the other live questions. So we did have another question about disparities. Let's see. I do have a question about the alliance. It says, is there a potential for any kind of similar alliance between UAB and Children's? It seems like there's a tremendous amount of potential for unification, similar to the alliance and our relationship with Cooper Green. Can you talk about the future of the school with Children's?
Yeah, so I think there's a tremendous future for us to continually be integrated collaborative partners. I don't necessarily see for the alliance sort of asset management style with St. Vincent's. Children's is a tremendous partner of supporting the medical school, our pediatric care faculty, whether they're surgical specialties or the Department of Pediatrics. Under Mike Warren and Tom Schuffelberger, they have been tremendous supporters of our vision, and I think they will continually do so. So I think we maximize already that relationship, and they've been tremendous in that partnership. I don't know that there's anything to gain by having it be different at this time, nor do I think either party would seek that.
Thank you for that. One question that came in says, what is your favorite part of your job or your week? You are so busy. I'd love to know what brings you joy during a very hectic schedule.
You know, besides going home, I would say when I have clinic to see patients or when I get a chance to discuss research. I think the things I don't get a chance as much to teach or interact with students or med students or residents as I would like. But back to who I am, I'm at core, I'm a surgeon, scientist, and educator. That's why I got into this. I didn't get in to do this job. So at the end of the day, what brings me enjoyment is taking care of patients, helping others learn, and being involved with discovery.
Wonderful. We might have time for 2 more questions. So you touched on this just a bit in your presentation, so maybe you could expand on it just a little bit. But what is the School of Medicine's plan to recruiting more diverse medical students? Yeah,
so one of the things that I did not mention that has occurred in our school that I think could be again a national model. We want to lead not only just at a local level, we want to lead at a national level. One of our board of visitors, Gail Castle, who was the former chair of Micro, sits on the Burroughs Welcome Board and really brought Burroughs Welcome and UAB together. And conceptually, what we put forward to them was we were beginning to establish and wanted to see if they would provide both support grant and long-term investment in helping us establish an early admission medical school program like our MSAT program at UAB with a set of historically Black colleges in our state. So we have more historically Black colleges in Alabama than any state besides North Carolina. And so our medical school team has begun the dialogue with Oakwood, with Alabama A&M and Tuskegee. And as a pilot with the support of Burroughs Welcome, we're now going to identify underrepresented minority students at these colleges who we now can begin the process of granting early admission to our medical school. We believe that that will be a unique pipeline that will allow them to both be brought in to our culture, for them to influence our culture, but also to be prepared as they graduate to be fully capable of doing an outstanding job as medical students, as we would expect for anyone going forward. So I think this platform, as it expands, becomes a rich model of what we will call Burroughs Welcome Fellows, who will be able to find their tracking to our school after their sophomore year of college, if they've met the criteria and excel, which I'm sure there will be many who will, and it will grow the diversity of our class and school.
Thank you so much. So it looks like we have time for one more very quick question. And this is a great one to end with. But as we move forward and grow and expand, what is the role of wellness as we move ahead?
I think wellness is fundamental. And because we were talking with a group of individuals yesterday about a program and a process to start a new entity. And it came back down at the end of the day, the best laid plans can go awry if people are not at their best. And who we want to be at UAB can only occur if all of our members are at their best. So I think we have to stay close and focused and attentive to having programs, having awareness, and having a sense that we value the well-being of all of our community members who work here, realizing that without that, we can't achieve, nor will they achieve the dreams they have. Nobody wants to be unwell. And when it occurs, it affects everybody who's in your sphere. And so we want to make sure that that is a focus. And to your question, it is a significant, if not a top priority, to make sure we can reach our goals for the future.
Thank you so much. We are right at 1 o'clock. So if you have any just final closing remarks, I'll go ahead and exit. Thank you.
Thank you for having this. I want to thank all those who've had a chance to listen. And those who haven't, thank you for all of the service and hard work that you've provided. Again, to the UAB community, to our patients, to Birmingham, Jefferson County, to Alabama, and our nation. We certainly couldn't be here and do this without you. And I thank our communication teams. Thank you for all the work that Jessica, Tyler, Paige, and you, Mary Ashley, have done. So appreciate you for your interest, your hard work, and the preparation for this event. Thank you all, and have a good day.